Hi there. This video is to introduce a relatively new part of the recall system, which is to stop recalls. Often we get queries about how do we stop patients from being monitored and invited. And it's something we've taken a while to develop because you need to be really careful with this. So this is a test patient. I can see some one-off requests here that I've done. And so there's already a function you can do cancel one-off requests. Yes, I want to cancel that, and that would take that out. You'd need to sort of save and retrieve the patient for that to take full effect. But things like that you can easily take off. Things that are patient specific, you can decline annual reviews on the red dot, and you've got options here like decline annual review and also delay monitoring or annual review. But these options don't remove patients from certainly high risk drug monitoring. It's too risky. Um, so, for example, this patient is on the flunomide, which I think is a DMARD, if I remember rightly. So you'd want to be really, really careful deciding not to invite this patient. Now, if a patient, say, is end of life or lacks capacity, then there's a clinical decision to be made balancing the risks of prescribing without monitoring, or maybe they need to deprescribe. And often deprescribing, again, might be the right thing to do, and that will stop the monitoring. But if you have done all those things and you do want to stop the monitoring for this patient, then we've got this stop recall page. So first of all, you need to kind of review what are the things that the system is saying ought to be done. And you've got lots of information up here. There's a kind of, I confirm I've understood. It will prevent all invites, visits and prompts for this patient to have reviews and monitoring. And I've reviewed what would normally be monitored for this patient. So this is the kind of nuclear option. This is the completely stop absolutely everything. Let's get rid of that. So first you've got to put the reason for it, either not wanted or not appropriate. You have to put the time frame, and the longest you can do this for is 1 year. We don't think it's really safe to make it longer. There is a report I'll show you that identifies patients who are coming up to the end of that period, whether it's 3 months, 6 months, or a year. If you stopped it previously, you can also resume normal invites, let's say 6 months. You can pick, or you need to pick what you're stopping. So again, the nuclear options are kind of all annual reviews, all monitoring tests. But you can just opt out of, say, bloods or specific things, and then you must put the reason. So I don't know, reviewed, lacks capacity, assessment made, and continuing to prescribe without monitoring in best interest. I don't know. You can tell that I don't do that actual job. And you can OK it and save it, and that will then remove the patient from all monitoring invites, all prompts for staff, all visit lists, everything. If I save and retrieve this patient, I can show you a bit what that then looks like. It will still display what things would normally be done, but they won't be invited. It's going to take a minute, isn't it? So you're now shown as black, excluded or declined. Yes, there are bloods that are here. If I were to action this, it's showing that they've declined the annual review. If I do the booking prompt, it is showing the flu-vac one. Maybe we need to think about excluding that as well, actually. But it's not prompting me to book annual reviews. One last thing to be aware of, if I now request bloods on this, on the request test template, it should pick up the fact that they're excluded from everything, and I think it will warn me about that. Let's double check. Yeah, patient will not be sent any invites because they're permanently excluded from all recalls. And then they've got the option to either say tests have been arranged or I need to send a task, because the usual processes like bulk sending invites will not work. Last thing to show you on this, if you want to use this, in this folder exclusions new, you've got this report here, review current exclusion expiring soon. So if you're using this quite a bit as a practice and there are some patients you don't want to then drop back into having invites, you might want to set a batch report on that, and it'll identify those who are coming up to be reviewed in the next sort of month or next few weeks. I hope that helps. Disclaimer is, treat this tool with care. And yeah, you need to be really conscious about how it's being used and who's using it in your practice. It definitely shouldn't be simply a patient doesn't want this and I just go through that process. So we've tried to make that really clear in here, and avoid people kind of stopping all that monitoring without properly thinking it through. If you've got any concerns, if you really want it disabling for your practice or something like that, then we could look at doing that. A few practices have been using it for a little while and not had any issues from it. So we hope it's a helpful tool for you all. Thanks.